Uh, Namaskar, good morning. Good morning to everyone. This is Engineer Suraj Singh back to you regarding conferring the status of COVID-19 under title Bharat, India, an analytical informative talk on COVID-19 status dated 25th December 2020, yesterday, which has been reported on 26th December 2020, that's this day, and this is spreadsheet sharing with you. Use every day I try to share with you this information, yet signals are not available. I don't know whether to come back or no. Even I continue, I have to do again, I don't know. Well, my dear friends, we cannot change. We are born not to change. Holy Day, Christmas Day, and we drop our work. And we think that holiday is only for purpose of enjoying. This is, I think, our thinking. It's our culture that we sleep, and of course, particularly on holiday, we have fundamental right to sleep. I'm telling all this due to certain reason. That reason we'll be talking today just after some time. Before that, I like to share with you yesterday's statistics of COVID-19 in this country, Bharat, India, state-wise data, Bharat, India, COVID-19, report on 26th December, pertinent 25th December, and this is state-wise names, and you can read those, but it's difficult to read sometimes, so I'm just speaking for those who may not be able to read. In Maharashtra, cases were 19 lakhs 13,382, Karnataka 9.14488 lakhs, Andhra Pradesh 8.8043 lakhs, and Tamil Nadu 8.12142 lakhs. I'm a little sick. Kerala 7.32084 lakhs, and Delhi 6.21439 lakhs. Uttar Pradesh 5.79982, and West Bengal 5.44755 lakhs, Odisha 3.278667 lakhs, and Rajasthan 3.03732 lakhs, Telangana 2.84391 lakhs, and Chhattisgarh 2.73279 lakhs, Haryana 2.60153 lakhs, and Bihar 2.48945 lakhs, Gujarat 2.40105 lakhs, Madhya Pradesh 2.36400 lakhs, Assam 2.15836 lakhs, and Punjab 1.64821 lakhs, J&K Jammu and Kashmir 1.19628 lakhs, and Jharkhand 1.1394954 lakhs, Uttarakhand 88,844, Himachal Pradesh 54,058, Goa 5,053, Puducherry 3,791, Tripura 332, Manipur 2,794, Chandigarh 1,934, Arunachal Pradesh 16, Meghalaya 1,336, Nagaland 118, Ladakh 935, Sikkim 568, Anbar and Nicobar 491, Mizoram 4, Dadra and Nagar Haveli 33, and Lakshadweep 0. This is statistics of yesterday, what happened regarding COVID-19 in our country. Other columns, as usual, active cases, discharge cases, deaths. These three are statistics of that, and this further here, you can say, these have been converted to percentages of that statistics so far. So we have to understand this, and that's what purpose of analysis is. We have to understand what is happening, what happened, what shall happen, what is proposal, what is not proposal, where do we want to reach, what time we have to control this, or we have to fail this, or we fail ourselves. And what we expect from state or from nation, and we have to chart out certain program. As an individual, I'm advising that. I'm not saying nation is going to chart out or government is going to chart out or you are going to chart out. According to control management, according to control organization, or what is best in risk cover or risk control or risk prevention, you can say loss prevention or risk prevention. It's only requirement that you must have certain program, certain schedule, certain milestones giving a solution, or you can reach solution on the achieve solution on that date. That's what is required here. But I'm not finding anything as such, and this is statistics here, 1.2% death, and you can say this is the average of HE4 and HE39. HE39 is here and HE4 is here. That's what average is this. Average deaths is 1.2%, and which cases have been discharged, this is 93.25%, and 2.77% active cases. You can say clubbing of these two active cases, and that is 3.97 today in today's report. So they have dropped it. In fact, 1.2 still remains there, and 93.8 they upgrade. They say, okay, discharge cases are higher, means they want to improve something. That's okay, fine, no problem. But this texture, this matrix here gives something which is very reasonable and demanding as well. It's warning area, it's precautionary area, it's alarming area. It's telling you what should be done on war level, which has not been witnessed being done, unfortunately. Unfortunately, sleeping nation is still sleeping, is not coming out of sweet dreams. So it says 1 month, first month, fourth month, 7, like this, a gap of 3 months or a quarter of a year, and we just understand our proportioning or interpolation or extrapolation of this, how it happens. When it is a period of 0.25 year, we apply a coefficient of 0.25 and get 1.2 to 1.5. You can see how 1.25, then 1.87, like this it goes up to 7.1 in 2 years time. This is just conventional method, and we say since deaths are as I saying, certain deaths 1.2%, which that is not actually real death. If you see number of what we have done, if you see 12.858% people only tested, 16.716 crore people only out of 130 crore have been tested, and 113.284 crores people have not been tested. So this percentage of 1.2, comes from this 16.716 crores people. This means if we apply this to 130 crore population of our country, this goes to 1.56 crores, and according to these coefficients, these figures of 1.95 to 9.29 crores come, and at the quarter frequency interval, you can say you will get these given figures: 2.44, 3.04, 3.81, 4.76, 5.95, 7.43, 9.29 crores. This is warning one, very big warning here, and this has been depicted on this curve. You can see here. This is only out of 1.2%, and if I club it together and check how it is, so you can see how there's a rise in this. You can say up to this value, This is too alarming, and we have to be concerned about this, that this could happen. I cannot say it shall happen, but it could happen. It could happen if it is very, very black time, where darkness it is, and we cannot control, we cannot go beyond our capacity to combat it. So let's now understand our problem And what our statistics give us? Statistics give us information only. Statistics gives information only, and that information should be used for reaching certain solution, certain program. Now this, if you can say here, these 5 highlighted columns contain information given by government of our country every day. Every day they present these 5 points. I take from there may be more points, but because I use this in analysis, so I collect this information out of whatever information they provide, because I don't want useless information. I want information that should be incorporated and used for purpose of conducting analysis. This is that analysis, and here most important point is that we have to find out these 5 columns, what these are. Our columns are which we have used, that is for purpose of calculation, means what is serial number, report day, remark, population, and percentage delivered. We just worked out all this. Total update they give, total test how many conducted, total update every day and total, and daily conducted, and of course then infection update and daily positive cases discovered or declared, and update deaths, total deaths update. That's what they provide, and I use. There are other information too which is on the use. I don't use that, means this active and disintegrated. Now our point of attraction on this day is that 16 crore 72 lakhs approximately, 60.72 lakhs approximately have been tested so far, which is equivalent to 12.85% of our population, and 87.142 have been kept on in dust, you can say. They are dusted, they are not given any importance for purpose of testing, because there exists no scheme from our country government to conduct tests for each and everybody. Unfortunately, every day they also give how many people were tested, and yesterday this figure you can see 8,53,527 persons were tested, and before that day means on 24th 9,97,396, and on 23rd 10,39,645, and like that. So there is a sharp fall in testing. You may say it's due to Christmas. Well, that's an excuse only, you can say. Actually on Christmas tests should increase rather than decreasing. So what is status of that? We should understand how much fall is there. This is considerable fall, you may say. Let's work out this and see how this works. Just a half a minute it takes. Yes, if you compare to yesterday, this fall is there, and this fall is drop, or you can say drawdown, or whatever you can call it. It doesn't matter. You can call anything. Percentage wise, this is 16.86% drop. 16.86% drop of testing between day before yesterday and yesterday. And if you take another day, say for example, I take this 100, so I would say, rather than this, I would say 100, and then I see it's 21.8% drop in these 3 days, 21. And you say another day here, 1098, that is a 99 here. You'll be surprised to see how this is working. So 28.66% drop. So you can yourself see what is degree of seriousness we are adopting. We are not very serious society. We are not at all serious. Why my video is not working? I think society. Why it's not serious? I don't know why it's not serious. There should be seriousness, but it's not. We are not serious at all, because we can say we are sleeping a lot. I can with guarantee say we are sleeping a lot. We do not care it's 28% down or whatever down it is. Means down for them. Whatever done is done. That's it. Don't worry about something else. Don't worry about anything else. Whatever is done, and that's it. We have done this, that's nothing else. Don't ask any question. If that is our culture, if that is our seriousness culture, well, I don't know which milestone shall we achieve. We will not achieve any milestone, rather we will lose whatever we do. All this statistics, all this data is going to dust only, nothing else. Professionally, I can say whatever data shared with you and whatever data may be issued in coming days and coming months is only formality. It's not going to be used. It's not going to be used for good purpose, for logical purpose, for certain purpose. It's just a formality, clerical work, administrative work, and that's all. Because they are not interested in solving problem. If they are only interested in one problem, you can say 22,273 people were declared passed. They are only interested in the truth world that we have come down. So we have good control because less number of people are being declared COVID-19 positive. They condone this. Condone, I mean to say ignore it. They ignore this percentage, they ignore this percentage, they ignore this and they ignore this. They only focus on how many persons, how many individuals were declared COVID positive on this day, and that's what is their milestone, that's what their criteria to declare successful. A kind of dream world, a fictitious success. I don't know how strong they are to adopt to such methods. There's so much data. Use it properly, understand it, and it's now not 1 day or 2 days. It's now, I think, it's now 26. It's now 301 days. We have crossed 300 days, and in 300 days, this is our achievement, that we tested only 12.853 people. This is our achievement. So if you can say, this is total population we tested, and we in 1 day we tested 5.55 lakhs. Means we are too low, we are too inefficient, we are not serious, and people too are not serious with government, of course. None of them is serious, and COVID-19 is flying very high. It's no more COVID-19, but strain COVID-19, and this is, variant COVID-19, and even Japan, Nigeria, it has been located in England, it has been located in Italy and France. We are no separate. We are not special for COVID. It will come, and maybe already there. We do not be serious, we do not become serious because we do not care. It exists everywhere. COVID-19 strain, COVID-19 variant, and it's from Japan to England, Africa through Africa, it is seen, Nigeria it is seen, Italy, Europe it is seen. So why you think it is now, it doesn't exist in ours? It, of course, for sure exists in ours. And we have to realize that fact. If we do not do anything now, we shall not have time to regret even. Because so far we say we have this one, that is 1,69,118 positive cases on record. This is on record, not actual. Actual is many times than this. Actual is many times than this, and it is 9 crore somewhere if you take over whole population, because this 1 crore approximately is out of 16.72 crores. So it becomes around 9 to 10 crores if you apply this value to 130 crore people. But since multiplication factor applies also every quarter month, and it's now 301 days, so it seems that it looks that about 35 crore people or more of course, have been impacted unknowingly. We don't have information, but it's exploding, and it is going to further explode, and it's going to further involve itself in nuclear chain reaction. I just joke with that. It's actually, we say, nation is sleeping and has to stop allowing corona to make corona bomb to explode, though corona nuclear fashion. And it's, you can see this curve, beautiful curve now, I should say beautiful curve. It's giving very good terrain, uneven odd terrain. And you can enjoy with this curve and see how beautiful it is. This means how efficient we are when we fall in ditch or we fall in valley, and it's difficult to come out. But when we come out, we again fall. Like that it happens. So it's just, Now, I don't know what to say, really. This form here, this highlighted area here, speaks something I every day explain. But I'm very disappointed, I'm annoyed that even after I sent to government, there's no information and no special, no additional information has been included on daily publication, and nobody is there to advise or to ask people or to ask government to expedite testing using multiplied resources or augmenting times, augmenting them. There's no such indication from government. I can't say why, because they don't want to help people. They just want people to be, contracted with COVID. I think that's what they think. There is no very good infrastructure in our country. Even then, nobody is serious. And we require to test 1.24 crore people every day. Otherwise, even what the speed it's going on, testing is going on, it shall require 1136 days minimum if it continues like this. Or there is some proposition from government or authorities that they want to conduct tests with everybody at this speed, or automatically people get sick and they report, and this 1136 factor has gone up today. Yesterday was something because of testing speed down. It's very, very down. It's 8,56,000, so it's 28% or 9% down last 4 days. And this is very serious issue. For holiday, we want to do more work or we have to sleep. We have to decide. Situation is very, very critical, and I think it must be understood very well. And that's what I can't show you this Word file, but I'll read this, what I posted. And for your information, I have posted various posts, and I published posts as well as videos pertinent to this COVID-19 in past weeks. These URLs of posts and videos are given on text of this video. You can see that, and also some message written in that, and that is Bharat India COVID-19 report update on 26/12/2024 noon. Bharat India has already crossed 1 crore COVID-19 individuals out of 130 crores, only 16.716 crores, or only 12.858% population tested so far. No worry for even COVID-19 strain plus or government of India or people of Bharat. India, as mostly people of ours have become careless and ignorant. No plan is available for remaining 87.14% population, which is remaining untested, which has made it impossible to fix certain required milestones and schedule out prospective time-scale based plan. Testing speed has been non-conducive. Real state of future of COVID-19 in Bharat, India cannot be correctly forecast or predicted analytically. In this connection, I have sent certain email many days past giving all certain URLs to government, which email acknowledgement was received, but no further response from government. No change or accelerating program is visible. In fact, testing speed has been still really very, very unsatisfactory. No change seems to be on part of our government. To an extent, testing on whole population is concerned. Government of India does not take any responsibility for testing of common citizen. It's assumed to be responsibility of citizen itself to have a test if one feels that it's affected or symptomized by COVID-19. Government of India has distanced itself from owning public health responsibility. Total tests conducted up to 25th December 2020, that is 16 crore 71 lakh 59,289 tests conducted on 25th December, 8 lakh 53,527 total corona infection till 25th December 2020, 1 crore 1 lakh 69,118 positive cases declared on 25th December 2020, 22,273 manipulated data by Government of India. My comments are there. Death update till 25th December 2020, 1,47,343. Population test is 12.858% only since March 2020. Remaining population remaining without tests is 87.142%. Time required for whole population testing 1,271 days. Time required for remaining population testing 1,136 days. Is 1,271 day or 1,136 required is admissible to you, or you have to reject it. You have to decide why is Government of India not improving its bad performance or very inefficient performance. Answer is not clear. There is no answer actually. Government of India has actually ignored poor, lower class society members from testing. Why is Government of India sleeping? There is no answer and cannot be. We are not getting any answer. They may not consider themselves sleeping, and you may also not consider them sleeping, or you think that they are very, very efficient and they are working with fast flying. You can think that. Government of India doesn't look anxious to test all citizens. Speed is too low. Why should people of Bharat, India suffer for none of their faults, and particularly those very poor people? Only sufferers are poor section who cannot afford treatment. Why are suffering people not raising voice? Are people voiceless? Why has Government of India left its responsibility on to people of this country? It seems that all people shall not be tested because till now no change in policy is seen, or actually there is no visible policy of Government of India which is observed. Really speaking, there exists no Government of India policy towards public handling of COVID-19, strain plus and variant. Poor people, if you intend to be COVID-19 tested, you have to do it by yourself on your own expense because no Government of India exists for you. You spend 1,200 to 2,400 rupees for testing one time. After testing over and being detected positive, pay for your treatment as well, along with medical assistance costs. Remember that medical attendant charge is 1,500 to 3,000 per day. If you isolate in your room, also all expenses of attendant, food, boarding and lodging, you have to afford. You have to buy medicines, injection, oxygen if required, pay for ventilator as well, all PPEs necessary for attendant. If you stay in hospital, rooms rent itself could cost you around 10,000 to 20,000 a minimum per day. Therefore, be ready with many lakhs rupees. People shall have to decide for themselves, for there exists no more responsible for you as far as government is concerned. COVID-19 virus explosion has to happen. It has happened already, but it has to multiply, it has to magnify, it has to thrive further on higher scale like nuclear fission in atomic process. Come what may, due to inefficiency and sleeping attitude of government of this country, COVID-19 shall certainly explode in our country, Bharat, India, in form of COVID-19 nuclear fission. A nation where neither public is serious nor government is serious, nothing other than explosion can happen. A society that remains non-serious and on top of that, sleeping should face such results. A nation that cannot think to resolve problems seriously, such results are of course imminent. Nation cannot wait for many years to have prevention from impact of COVID-19. Out of my understanding, 1.3 billion people, including many crores intellectuals, but they are only nothing except lip service, and sometimes lips are also stitched. Speak up, all to take necessary action because Government of India is totally lethargic. Government of India trying to ignore COVID-19 by diverting issues, think to get a working Government of India, not current sleeping one. Guard can also sleep, don't forget that. My dear friends, I'm not against anybody, just for your information, and I'm neither in favor of someone. I'm a neutral person, but I am in interest of good of my country, good of people. I'm not agent of government, I am agent of none, except I am supportive to public. Public is, I am part of public, and you too are part of public. Government is installed to serve people, and if government serves, it's very nice. I support that government, and if government does not serve, government doesn't stand to meet requirements or meet expectations, if not all expectations, at least some expectations, it's fine, but it doesn't happen at all. At all, at all. I repeat, it didn't happen. Speaking plainly, I can simply say again, same statement, we are sleeping people, we are sleeping society, we are sleeping nation, we are sleeping government. We are inefficient in all public and in government. There's no interest to test whole population. Drastic failure is accepted by everybody in terms of success. Where there's a failure, we shout, oh, we are successful. This happens. If you fail, you say, no, I'm pass, fine. There's no policy, there exists no policy, and the question of change of policy arises only when you have some policy. So we are different class of people. We don't value lives of people, we don't value really, we don't do. Even if crore people die, nobody would be affected in our country. Well, if nobody affected our country, even if whatever happens, it is our you can say, it's our, what we say, that we don't even feel something like that. We don't even feel something like that, and we move as if nothing happens, and it is really, you can say means it's really, oh, I'm sorry, there's some error on here, yeah. Yes, some mistake happened, and there's some split, I was removing the split and it angle. Okay, no problem. So what I say that I should not all time criticize, I don't like it to criticize government and others, but it's our right, it means it's our duty as well, our right to have good medical care, health care, at least community level care. We are not demanding something very specific. It's our money, our tax, our revenue, the government keeps with it. And if government does not use it for people, then you can say how can we live, how can we be healthy, and throughout the world we say HSE, that's called health, safety and environment. It's question of health maintenance or keep up of health. It's keep up of health, it's keep up of safety. If we are not healthy, we cannot do anything, you see. Our health is of utmost importance. Particularly those class of people who develop, who produce something. Our moneyed people do not produce anything. Our industrial workers, our workers and farmers, farming workers, and those who deliver hard work, physical hard work, they add to contribution. They contribute to our economy, they contribute to nation, so they should be taken care of. But of course they are very well immunized people, strength is higher than others, yet COVID can go to everyone. COVID can go to everyone. This point we should understand. We cannot miss this point. Controls lie here. It's here, I want I want that in 3 months it should be done. In 3 months. You may say when it could not be done. In 301 days, how can we do in 3 months? And that's what I say, that's what we want to achieve. If we could not do something in 301 days, we should do in 3 months. Yes, we should do in 3 months. If we expect our nation, if we expect our people to stay safe, to be healthy, to get avoidance of COVID-19 contraction, we have to go for this, which means whatever resources we do have should be added with 11 times more. And if it's 6 months, it should be 6 times more. That's the only answer. No other answer in this talk. If they can do, it's fine. If they consider 6 months period, you have to test every day so many individuals. This says 62 lakhs, more than 62 lakhs. And in this case of 3 months, we have to, you can say double than that, which is 1.24 crores. Choice is yours. Choice is public choice. Nothing more than this can be said, and this is, I can blow it up for you if you want to see in a good way. It's that, if you cannot see, you see it now, blown up mode. And you may be saying, well, I'm talking like this. Yes, I'm talking like this because it is required. Well, I would not say anything else except this, because excessively talking is also not good. This is a very serious issue. It cannot be taken for fun. It's a question of life and death. So, life wins or death wins. That's what we have to do. Who defeats whom? We do not want to see who defeats whom. We want to see that every life is important. Every life is, should be risk-free, except those who die natural death. It's something else. And we have to be very sensible society, because we are now 130 crores, number one in population as far as COVID-19 is concerned. We failed actually from very beginning. Since beginning we failed. We did not take any care, and still I am finding that people are not very careful. Still ignorance is there, and worry doesn't exist. People are not having any degree of worry. Because they have not been given right information for this issue. They have not been educated properly, which leads to such abuse of state. Common citizens still think, oh, don't worry, nothing happens. But that is misleading thought. Even I think village people think that it cannot happen to them. This COVID cannot come to them. But this is misconcept. Yes, you may not feel that asymptomatic you are. You may not feel that. It doesn't mean that you can't have COVID. Okay, you don't have. You may be having hidden strength, but you can infect others. That could happen, and that shall happen. You could impact weaker person who is weaker than you. So what I say today, that we have to be not enthusiastic that way, and we have not to be very positive also, because we are already in negative status. We are losing a lot, and those people only in higher profiles, they are fine because they can afford, they are having affluency, but we don't have. Those poor people, haves not, I say, those haves not, for whom I am serious, for whom I am interested in, and government should be interested for them. But I do not know reasons behind government showing no interest in preservation or pre-action for those people. I cannot say why, because of funds or because of they don't care for people or they don't. I don't believe in all this. It's their duty, it's their constitutional duty, it's their legal and political duty to help poor. And with that, I hope that maybe not today, tomorrow, government ears will erect and their eyes will open, which are closed till now. So I have no more comments on this. I'll see you tomorrow. और आप कहते थे कुछ हिंदी में बता दो, तो हिंदी में मैं यही कहूँगा कि हालत बहुत सीरियस है। आप जानते हैं कि कितने केस हो चुके हैं। 113 करोड़ लोगों के अभी तक टेस्ट नहीं हो पाए हैं, ये भी सच्ची बात है। 113 करोड़ लोगों के टेस्ट नहीं हो पाए हैं, और जो टेस्ट हुए हैं वो 16 करोड़ 72 लाख लोगों के हुए हैं, और अभी तक 1 करोड़ से ऊपर 1,70,000 के करीब केस हो चुके हैं। और टेस्ट करने में हम बहुत पीछे, जबकि टेस्ट होने चाहिए 1.25 करोड़ के आसपास रोज या 70 लाख रोज, वहाँ हो रहे हैं 8 लाख, 9 लाख, 10 लाख, जो कि बहुत पीछे है। और हमें ये सोचना पड़ेगा कि आने वाले समय में हमारे कितने लोग फंसेंगे कोविड में, जो कि आज शायद हम मजाक उड़ा रहे हैं। और क्या हम 11 से 36 दिन प्रतीक्षा कर पाएंगे, वही भी एक प्रश्न उठता है। हम नहीं कर पाएंगे, लेकिन आज हालात ऐसे ही है कि जैसी स्थिति बनी हुई है, इसको 1136 दिन या 1200 दिन लगेंगे टेस्ट करने में, जो कि कोई फ़ायदा नहीं है। तब तक तो हाल बहुत बुरा हो जाएगा। इसलिए आप लोगों को समझना चाहिए कि हमारी हालत बहुत बुरी है, और कोविड बढ़ता जा रहा है और शक्तिशाली होता जा रहा है। कोविड का स्ट्रेन भी जा रहा है, आ रहा है। स्ट्रेन आप जानते हैं क्या होता है। स्ट्रेन का मतलब किसी चीज़ पर दबाव डाला जाए और वो कितनी छोटी या बड़ी हो जाए, उसको स्ट्रेन कहते हैं। तो जब वो स्ट्रेन ऐसा आने वाला है, तो सोच लीजिए कि क्या हालत होगी। ये बात सोचने की है। कोविड वेरिएंट आ रहा है, जापान में आ गया, इंग्लैंड में आ गया, नाइजीरिया में आ गया, आपका यूरोप में आ गया, और हमारे यहाँ भी है, हम बताएंगे नहीं। और अब अगर हम टेस्ट को बढ़ा सकते हैं तो ठीक होगा, स्पीड बढ़ाएं, कई गुना बढ़ाएं, एक बार नहीं। हमें 12 गुना, 6 गुना, 12 गुना, 7 गुना, 8 गुना, 9 गुना स्पीड करनी होगी, तब कुछ हम संभल पाएंगे। नहीं तो आने वाला समय हमें आज दिख रहा है क्या होने वाला है। इसलिए हमें बहुत गंभीरता से यह सोचना पड़ेगा। बाकी आप लोग समझदार हैं और आप जानते हैं कि हम क्या कहना चाहते हैं। इन चीज़ों से लड़ना पड़ेगा सरकार को, पब्लिक को मिल के, क्योंकि ये बात बहुत ही गंभीर है, बहुत गंभीर विषय। और शायद आम लोग जो ज़्यादा पैसा नहीं रखते, जो कोविड का टेस्ट कराने का पैसा भी नहीं रख सकते, क्योंकि सरकार टेस्ट कराएगी नहीं कराएगी कुछ नहीं कहा जा सकता। आज की स्थिति जो है, कोई सूचना नहीं है सरकार की तरफ से कि उनकी क्या प्लान है आगे का। मजाक अलग चीज़ होती है, लेकिन जब वास्तविकता हेल्थ पर आती है, सेहत पर आती है, तो बहुत कुछ रंग बदल जाते हैं, क्योंकि वहाँ खर्चे होते हैं और सरकार शायद खर्चा ना करना चाहे कोविड के लिए, और आपके पास हो ना खर्चने के लिए, तो क्या होगा आप इस बात को बड़ी आसानी से समझ सकते हैं। अगर आप नहीं समझ सकते तो समझने की कोशिश करें। आप भी मोबाइल पे सब कुछ देखते हैं, गाने बजाने, फिल्में, कभी कभी इसको भी देख लिया करें। आप ही का नुकसान नहीं होगा, कुछ ना कुछ आपको सूचना ही प्राप्त होगी। वैसे मैं कुछ दिन से ये सूचनाएं आपको दे रहा हूँ, क्योंकि अच्छा है कम से कम पब्लिक को कुछ पता तो लगे, नहीं तो सब कुछ अंधकार में रह जाता है। हालत मैं फिर कह रहा हूँ बहुत बुरी, लिमिट से बाहर हो चुकी है और आप लोग इस बात को नहीं समझ पा रहे, और जब समझेंगे तब बहुत देर हो चुकी होगी। इसीलिए अभी समझ जाएं तो अच्छा होगा, बाकी आपकी इच्छा है। अब मैं कल बात करूँगा आपसे। जय भारत। आप सब